Am I a candidate for cosmetic dentistry procedures? Really depends on the type of procedure you're looking to have. We fall under the 3 different categories of cosmetic dentistry procedures, looking at the first one, which is teeth whitening. Most people are candidates. The ones that aren't candidates are usually they have extreme sensitivity, preventing them from having teeth whitening, or they've got just say teeth in the front that have been restored with porcelain that's not going to change color, or they've got usually a lot of recession, in which case they can still do the whitening, but we have to be careful not to get any of the whitening gel on the roots. It'll be very sensitive. So most people in essence are candidates for teeth whitening, and the few that aren't, usually it's because of having dental work on the front or extreme sensitivity. And there's also a subsection of people that have a certain type of staining on their teeth that won't really whiten from the whitening. It's called tetracycline stains. It's not very often people have it, but if they do, you'll find the dentist warning people that their teeth will get brighter, but not whiter, and not really have a great result from the whitening. Now, the second category is orthodontics or braces, whether it's traditional braces or Invisalign braces. Most people who have crooked teeth are candidates for traditional braces and Invisalign braces. And the way traditional braces work, they can treat almost 99% of the cases out there with traditional braces, which are the wires and the brackets. The people that aren't candidates are people that have severe gum and bone disease and have lost a lot of the bone that holds the teeth in their mouth. Or if you've had a lot of cavities, they need to be resolved first prior to having braces. And the way Invisalign works, it's a form of braces. It's just without the brackets and the wires. Sometimes if people have very complicated cases, they're not candidates for Invisalign. However, in some hands, certain dentists and orthodontists who are very experienced with Invisalign can use it almost as much as braces, but it's really dependent on how often and how much the dentist uses the Invisalign. And again, if someone has severe gum and bone disease, they're generally not a candidate for Invisalign, or if they have a lot of cavities, they need to be resolved prior to having Invisalign. Smile makeovers is a third category. This involves porcelain veneers and crowns, full mouth reconstruction, facelift dentistry, all those sort of generic terms I've explained in other videos, all wrapped up into this. Most people, again, are candidates for having that type of work done. Limiting factors can be if they've lost all their teeth. Then those are, they can be done, but in a different method. They'll involve implants. If they've had severe gum and bone disease, then again, there's different sort of formulations, but we're not keeping the teeth. I hope you found this helpful. I look forward to any questions you have. Feel free to email us. Thanks.